All right, welcome to The Explainer. Today, we are diving into a sound that, let's be honest, millions of us know all too well. Yep, we're talking about snoring. You know that sound, right? That rumble from the other side of the bed? Maybe you're the one making it, or maybe you're the one staring at the ceiling listening to it. It just feels like a frustrating part of life, doesn't it? But here's the big question. Is it just a noise? So in this explainer, we're going to pull back the curtain and get real about what's happening when someone snores. We'll get into the science behind the sound, what it might mean for your health, and maybe most importantly, what you can actually do about it. Ready? Let's get into it. All right, first up, that noise at night. We're going to define what experts call primary snoring. So what does that actually mean, primary snoring? Well, simply put, it's those loud breathing sounds you hear during sleep. They happen because the tissues in the upper airway are, vibrating. But here's the really crucial part. This happens without a major drop in airflow or oxygen. So yeah, it might be super loud, but the person's body is still getting all the air it needs. That's key. Okay, next section, how snoring actually works. Let's look at the science behind the sound. So how does a quiet breath suddenly turn into something that sounds like a freight train? The mechanics are actually pretty simple. Let's break it down. It really comes down to a four-step chain reaction. First, when you drift off to sleep, all the muscles in your throat just relax. We're talking about your soft palate, your tongue, the whole setup. Step two, because those muscles are so relaxed, your airway gets a little bit narrower. Then, as you breathe, the air has to squeeze through that tighter space. And what happens when air moves fast through a tight space? The soft tissues start to vibrate. And that vibration, that is the sound we call snoring. Simple as that. All right, pay close attention here, because this is probably the most important part of our whole discussion. We need to talk about snoring versus sleep apnea. Making this distinction is absolutely critical. Okay, let's break this down. On one side, you've got primary snoring. With that, the air is still flowing continuously, your oxygen levels are stable, you're not really waking up from it. But then you have obstructive sleep apnea, and this is a whole different ballgame. Here, the airway doesn't just get narrow, it actually collapses over and over again. This means you literally stop breathing for short periods. Your oxygen levels can drop, which is dangerous, and your brain has to keep jolting you partially awake just so you can start breathing again. See the difference? It is massive. So the big question is, why do some people snore and others don't? Why are some people a gentle breeze and others a full-on thunderstorm? Let's uncover some of the most common triggers. Here are some of the usual suspects. For example, extra weight, especially around the neck, can put more pressure on the airway. Having a drink before bed or taking certain sedatives, well, those relax your throat muscles even more than usual, making that narrowing effect worse. And sometimes it's as simple as a stuffy nose from allergies or a cold. It all contributes. But, out of all the factors, there's one that stands out as a huge trigger for so many people. And it's simply this: sleeping on your back. Think about it. When you're on your back, gravity just takes over. Your tongue can fall backward into your throat, and poof, you've got a narrower airway, making snoring way more likely. It's the #1 positional factor, hands down. Okay, but here's the good news. If we're talking about primary snoring, you are not helpless. Not at all. There are a ton of things you can do. Let's look at your toolkit for a quieter night. First up, and honestly, this can be the most effective, just some simple lifestyle changes. Remember those risk factors we just talked about? Tackling those head on, like managing your weight or just skipping that nightcap right before you hit the hay, can make a massive difference. Next up, positional therapy. This sounds fancy, but it's really not. Since we know sleeping on your back is a huge culprit, the solution can be as simple as, well, not sleeping on your back. You can use pillows to kind of wedge yourself onto your side. It's a low-tech way to fight back against gravity. Okay, what if the problem starts in your nose? Well, then the fix might be right there too. If you're all stuffed up, things like nasal strips that you just stick on your nose, or even a simple saline spray can help open everything up and make breathing and sleeping a lot quieter. Now, for snoring that's a bit more stubborn, there are oral appliances. A doctor or dentist can get you fitted for one. It's basically like a mouth guard, but it's designed to do something really clever. It gently pushes your lower jaw forward just a tiny bit. And that little nudge can be just enough to open up the airway in the back of your throat and stop the vibration. So, let's bring this all together. We've talked about what snoring is, why it happens, and what you can do about it. So what's the bottom line here? What's the one thing you really need to remember?
This right here, this quote really nails it. Snoring isn't just some random noise your body makes. It is a real physical sign that your airway is meeting some resistance. It means something is getting in the way of a smooth, easy breath. So even if it's not sleep apnea, that sound tells you that your airway is at least partially narrowed.
And that's really the big takeaway. That sound, snoring, it's more than just an annoying noise. It's a signal. It's your body telling you something about how you're breathing when you're asleep. And yeah, a lot of the time it's harmless, but it should never be just completely dismissed. So think of it less as a problem for your partner and more as a message for you. The only question left is, are you listening?